Okay, tell me your name and how you spell it.
Rocío, R-O-C-I-O, Villalobos, V-I-L-L-A-L-O-B-O-S.
And your title?
In English or
Are
Spanish?
you with RiseUp TX? Either way.
I am an organizer and media team member with RiseUp Levanta, Texas.
Now tell me in Spanish, what were you guys out there doing today?
Estamos aquí para demostrar nuestra oposición a los proyectos de ley que quieren pasar aquí en la legislatura. Pensamos que estos proyectos de ley van a dañar las oportunidades que mujeres tienen para acceder a servicios, no solamente para recibir abortos, sino para recibir tratamiento de cáncer, de diferentes tipos de enfermedades, de anticonceptivos. Pero el punto es que no nada más es un asunto que se trata acerca de recibir servicios para abortar, sino que las clínicas que serían afectadas por estos proyectos de ley también ofrecen otros servicios que permiten que mujeres puedan tener vidas saludables y no tener que preocuparse por su bienestar.
I think you hit on this a little bit, but this will really hurt women as far as clinics go, is that right?
Si este proyecto de ley es aprobado, cambiaría el número de clínicas que pueden ofrecer no solamente servicios para recibir un aborto, sino otros servicios de salud. Ahorita hay aproximadamente 42 clínicas que pueden ofrecer esos servicios, pero si los proyectos de ley son aprobados, el número sería solamente 5. Entonces vemos que comunidades pobres en áreas rurales, en áreas fronterizas que son populadas por mujeres latinas, mujeres de color, mujeres de diferentes comunidades, no tendrían la habilidad de acceder a estos servicios, y si quisieran recibir estos servicios tendrían que viajar hasta más de 1000 millas en unos casos para recibir los servicios.
Last question. I asked your partner do you think the people for the bill said we're just trying to make it healthier, trying to make healthcare more healthier, clinics be more healthy? Do you think they consider the side effects, the ripple effects of closing down clinics like this?
Creo que por la mayoría no se han enfocado en los otros efectos, las otras consecuencias de estos proyectos de ley. No es solamente acerca de aborto, es acerca de servicios que permiten que mujeres puedan tener acceso a servicios que pueden salvar sus vidas, que pueden obtener mamografía si lo necesitan, que pueden tener exámenes para ver si tienen cáncer o no. Entonces es un tema que es mucho más amplio, más grande, y queremos que más personas piensen en las otras consecuencias de estos proyectos de ley, no nada más que se enfoquen en si una mujer quiere recibir un aborto o no. Al fin del día es sobre el bienestar de la mujer y su capacidad de hacer decisiones por sí misma acerca de lo que necesita para poder vivir una vida saludable y feliz.
Thank you very much.
Thank you.
So first, tell me your name and how you spell it.
My name is Rockie Gonzalez. That's R-O-C-K-I-E G-O-N-Z-A-L-E-Z.
And your title?
My title is Media Spokesperson for Levanta, RiseUp Texas.
So first, tell me, what are you doing here today?
I am here with my coalition. We're a coalition of lots of different community groups who have come together to organize against the passage of this legislation, HB2 and SB1. We are here to tear open the two-sided abortion debate and bring attention to the adverse effects on immigrant communities and people of color communities.
What are some of those effects?
We feel that this legislation basically makes it so that Latina women, African American women, and people in rural Texas are going to have less access to healthcare such as mammograms, well woman care, prenatal checkups, and even cancer screenings and diabetes screenings. These kinds of things are often overlooked in the two-sided abortion debate, And we really believe that communities of faith, immigrant communities, communities of color are essential to the movement and to making the struggle happen.
So I guess your fear is if they shut down those facilities, then we'd be necessarily shutting down abortion clinics, but a lot of other things as well.
Exactly. There are plenty of clinics that are really the only place in rural Texas. For example, if they shut down Whole Women's Health in McAllen, Texas, in the Rio Grande Valley, some women will have to travel over 1,000 miles for care. Some of the clinics that are going to be forcibly closed down are clinics where women go to get these cancer screenings, to get these mammograms, to get their annual checkups, and for women who have chosen to give birth, prenatal care. Oftentimes, people in rural Texas and immigrant community people cannot afford to pay higher premiums for prenatal care, and it's essential. We really want to advocate for mothers and children who are living, who are born, who really need access to this kind of health care, and this is their only option. Closing these clinics down doesn't just restrict abortions, it restricts a whole slew of health care that people really need.
Do you think this will actually make it worse? Lack of, I guess?
Yes, it will definitely make it worse. The people who are affected by this legislation are not necessarily people in urban places. They are not middle or upper class women. They are disproportionately rural Texans, women of color, and immigrant people who will lose their primary access to health care. Those most affected by this legislation are not urban, middle, or upper class women. RiseUp Texas, Levanta Texas stands in solidarity with all of the communities that will suffer the loss of well woman care, cancer screenings, mammograms, birth control, prenatal care, and even testing for diabetes. The hidden consequences of this legislation have been neglected in this two-sided abortion debate, and we must dig deeper to reveal the cost of SB1 and HB2. This is Rachel Caballero from Mamas of Color Rising from Austin, Texas.
Good morning, my name is Rachel Caballero and I'm here representing Mamas of Color Rising, and I'll read a collective statement by our organization. Mamas of Color Rising is a collective of mothers of color based in and around Austin, Texas. For 7 years, we have organized ourselves and other women and mamas of color around issues that most affect poor and working class mothers of color, including access to food, housing, education, safety, and healthcare. For the last 4 years, our primary focus has been our Birth Justice campaign, which seeks to open access to a full spectrum of birthing options for poor and working class women of color. We come to this project from a race and class analysis and use the term medical apartheid to describe what we observe as a deliberate effort to strip poor women of color of their rights to reproductive health and choices in perinatal care. Medical apartheid has contributed to shocking disparities in birth outcomes for women of color and their babies, especially Black women compared to white women. We are heartened to see the tremendous outcry from the public to defend women's rights to abortion in the state of Texas. And it is an important fight for us as women of color. However, fighting for abortion rights as a single issue is particularly complicated for communities of color, in part because people of color in the U.S. have a different historical connection to the question of ending pregnancy. Beginning with the enslavement of Africans and the colonization of indigenous communities, this country was founded on stripping the reproductive control of communities of color and generally attempting to maintain control over our bodies. These practices have continued well into the 20th and 21st centuries with forced sterilization of Black and brown women in many different instances, The most recent headline on this came out this week about the coerced sterilization of possibly hundreds of women incarcerated by the state of California. These coerced sterilizations in California and the anti-choice bills here in Texas are part of the same system of reproductive control that aims to maintain the historical existence of a racist, classist, sexist, genocidal, and hierarchical order that fatally impacts the life chances of people of color. In particularly, we are talking about legislation and attacks on reproduction that are directed right at working class and poor women of color. By and large, our feeling is that mainstream abortion rights struggles do not even see this history and its living legacy, which has been very alienating to many of the communities who will be most affected by the legislation that our Senate will hear today. The right to abortion is only one small slice of our full struggle for control over our reproduction and our bodies. We would like to call on each and every individual who has shown their passion over the last several weeks about abortion rights to extend that commitment to fighting for full reproductive autonomy and self-determination for every woman, not just those who can afford it, where the option of ending a pregnancy and the full option of keeping a pregnancy are both truly available. We call on each of you to not only recognize the fact that reproductive justice is a matter of racial and economic justice, but that those who live the experience of racial and class marginalization should be part of the leadership of guiding a movement for reproductive justice. For us, the struggle that matters is not what gets decided in this building over the next few weeks. What matters to us is the continuous struggle against all violence against women of color until no government ever faces a political landscape in which our rights to self-determination over all aspects of our lives and our bodies could be taken away. Thank you. For more information, or if you'd like to contact our organization, you can reach us at mamasofcolorrising.wordpress.com. Thank you. Thank you.
There we go. Rise Up Levanta Texas invites Monica Ortiz to speak on behalf of her community.
Hi, my name is Monica Teresa Ortiz. I was born and raised here in Texas, and I wasn't born and raised in a city. I come from the farms and rural areas of the Panhandle, where a lot of folks wearing the blue t-shirts come from also. We come from the same place. We grew up in the same way. And those are my parents, and those are my grandparents, those are my cousins, those are my kin. I wasn't wired to think any differently from them. But as you can see, I'm not standing with them today, and I'm not wearing a blue t-shirt. I'm here with the women and the supporters who have been on the Capitol grounds the last couple of weeks asking our legislators, asking our elected officials to not close those clinics that my family members who are working class people of color from rural areas, to close those clinics that they use for basic services like preventative care against cancer and diabetes. According to the American Congress of Obstetricians and Gynecologists, the Committee on Health Care for Underserved Women, rural residents are more likely to be poor, to lack health insurance, and rely substantially on Medicare and Medicaid, and they also have to travel longer distances to receive care or access to a range of medical, dental, and mental specialty services. So I'm standing up here because my family and other women from rural areas should have access to these services. HB2 and SB1 are leaving communities of color and women from rural areas behind, And while I left the Plains where I grew up a very long time ago, I've never forgotten where I come from. Thank you.
Our mission as a coalition is to bring attention to the fact that this type of legislation adversely and disproportionately affects immigrant communities and communities of color, citizens and non-citizens alike. It's our mission to bring this message to the two-sided abortion debate and widen the conversation so that the issues that affect rural Texans, people in the Rio Grande Valley, in El Paso, West Texas, and East Texas can have access to the resources that they need for their health care. Thank you all so much for coming and hearing our message. Again, we are Levanta Rise Up Texas. You can find our information at RiseUpTX.org and follow all of our information and all of our updates. Again, our mission is to bring to the abortion debate a wider conversation about the issues and the problems with this legislation that disproportionately affects communities of color and immigrant communities. Thank you.
They see the injustice of bills that jeopardize Texas women, the injustice to lead budget writers to slash women's health money, the injustice to shut down essential women's clinics to make a political point and let the governor veto a bill that simply ensures a woman can pursue equal pay for equal work under state law. It's the same injustice that afflicts our kids when they sit down in an overcrowded classroom, that wears out working parents who can't find health coverage for themselves or their kids, that rewards corporations with incentives and abatements while shortchanging Texas school children and commuters on our clogged highways, and that plagues our democracy when deals are cut and games are rigged in back rooms that our citizens never see. Texas can do better. These Democratic senators, and let me introduce them real quickly.
And that's why this today, standing here, Stand With Texas Women, our tour, is so important. There will be events around the state with community members and medical leaders who urge the legislature to protect women's health. Even if my colleagues in the House and Senate won't hear them, the people will. I thank you for being here with us today. I'm astonished that here we are, as Leslie said, in a second session, that the state leaders will go so far to restrict women's access to safe and legal health care. Yet they won't do this for all the children that are on the CPS rosters, those caseloads. They won't do this, except the only time, you know, that we've actually funded education, public education, was in response to a lawsuit. We won't do that for the kids. And so it's just astonishing to me that here we are going through such measures to protect a group of people that they purport to believe in and under the guise of women's health, but they don't do anything, and they go against the children that are already here and that me and my colleagues work so hard to protect. Thank you.
Thank you, Jessica, and thanks to all the House members for all their good leadership. As you know, today that bill starts being debated in the House, and they're there ready to stand up for Texas women. So thank you.
Thank you.
You know, we've seen it time and time again during the regular session, and then the first special where the rules were changed. Now the second where the rules and traditions have been changed again. The effort to block the voice that stands up for Texas women. That voice will not be blocked. That voice will not be blocked. And one of the people that made sure that voice would not be blocked was someone who was willing to have the courage, was smart. Frankly, she was brilliant that day. Ladies and gentlemen, our great friend, Senator Wendy Davis.
Thank you all. I am so proud to be standing here with you today, and of course it's an honor to be joined and supported by my brilliant Senate colleagues who did such an amazing job when we had the Senate debate on this bill. The reason that we are here, of course, is simple. The partisan leadership in charge does not respect the right of all Texans to make critical, personal decisions for themselves. They are tying their own partisan political ambitions and political goals to the stripping away of women's health care and the ability of mothers to stay healthy to care for their children. And they do not respect the power that all of you have had when making your voices heard. We are traveling around Texas to hear your stories, to learn about your personal challenges, and to stand with you against a state leadership that has become a very real threat to Texans' rights and the well-being of Texas families. The people's filibuster 2 weeks ago blocked a misguided, dishonest, and dangerous bill that would deny health care to Texas women. That filibuster, though, was more than a single event to block a bad bill. It was an expression of democracy in action and a clear signal that Texans have had enough. They've had enough of state leaders ending health care for 150,000 women, taking away their ability to stay strong and healthy for their families. They've had enough of state leaders turning their backs on Texas school children by failing to provide the basic necessities for our neighborhood schools. Most of all, they've had enough of selfish, ideological leaders who have replaced public service with desires for personal advancement.
Members, the question occurs on passage of House Bill 2 to engrossment to record vote. Vote aye, vote nay. Clerk, ring the bell. Show Mr. Guerin voting aye. Have all voted? Have all members voted?
Let's see what happens here.
Being 98 ayes and 49 nays, House Bill 2 is passed to engrossment.